Look at that. That's a beautiful baby you got there.
It's extremely unique, the Cancer in Pregnancy and Reproduction program. We didn't want to send patients different places at different visits because, as you can imagine, it could be an extremely stressful time. Most pregnancies are very happy without problems, but not all of them. And we recognize how challenging that is for the patient and for her family. You know, you hear it said a lot, but it's really true. We're not just taking care of the disease, we're taking care of a patient with problems that go way beyond what we can diagnose. One of the reasons I personally got involved was because in my experience over decades, many women, and I would say far too many women, are told to have a termination of pregnancy. And in the great majority of cases, that's not necessary. In order to answer that question intelligently, we knew we needed a multidisciplinary approach. We needed maternal-fetal medicine specialists, we needed the patient's obstetrician, surgical oncologists, medical oncologists, really a whole multidisciplinary team. Part of that was creating a patient navigator position. That's really the glue to what we provide because there are many physicians and many nurses, but we have 2 patient navigators, and they really are the face and the voice of the program, and it's been fabulous for the patients. A family who had a daughter that went through cancer during the pregnancy came to us to see if they could help. David and Amy Kornblatt, their daughter is Michelle Cohn, and her husband, Josh Cohn. And they very generously gave us funds to support our program. The main focus of their support was for us to get a research coordinator that could help us do the clinical research that was so important, and also for us to join the international registry and to support our presence in international meetings at this. I think one of the exciting things about this program is we're asking questions, we want to ask questions that nobody's asked before, because this is such an unusual problem and it's kind of a scary problem, certainly to the patients and their families, but also to a lot of doctors. And so we have the ability to tell patients, you haven't done this before, but we have. Most of all, I'm grateful and I'm proud of the team that I work with. And I can't and I don't do this alone. The way I would describe it is we're all rowing in the same direction. We all have the same goal. First 2 goals are listening and teaching. And I think that's the type of relationship that we build with our patients that makes a really, really scary situation a little less scary.